Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Sara Almeida joins me to speak about the economics of medicine sampling and quality testing. Sara, falsified medicine are a public health concern. Can you explain a bit more?
Yes, so the term substandard and falsified medicines refers to medicines that either don't match their quality standards or that were deliberately mislabeled in terms of their identity, source, or composition. One way of measuring how big the problem is and finding ways to prevent it is to collect and test medicines at selling point.
The STARmeds project looked at the value of sampling and testing, and in particular the cost of surveillance. What did you find?
So the STARmeds project contributed to the evidence on the amount of substandard and falsified medicines in Indonesia by collecting and testing about 1,300 medicines of 5 different types of medicines in both physical and online outlets. Then what the economic evaluation team did was to estimate the costs of these activities. So we found that for STARmeds, it costs about $480 per medicine sample collected and almost $6,000 per substandard medicine identified. We found that about 70% of these costs were lab testing, and the biggest drivers of the costs of analyzing and testing medicines for quality were the amount of bad quality medicines that are in the market and the price of the medicines that we were sampling.
And as part of your STARmeds project, you created a data visualization tool. What is its intended use?
So that our work is replicable and used by other researchers and regulators working on sampling and testing medicines, we developed this free-use web-based tool where anyone can use to plan their data collecting and testing activities. And we think this is a very important part of our work because it can allow researchers and regulators in low resource settings to plan their activities, which can be very important for an efficient use of their budget.
Thank you so much for your time today.
Thank you, Sabine.